13,000 people in our communities have died because of delays, inactions, and misplaced
The
priorities.
pandemic has highlighted the issues in some of our state's nursing homes and long-term care facilities, and a group of lawmakers and community leaders are putting out a call for action to help protect lives. For more than a year now, our Angie Moreski has been highlighting this issue.
And Angie joins us now with what's being proposed to help address problems at the state's nursing homes, especially in the wake of COVID. And Angie, this sounds like a pretty big issue.
Melanie, David, it definitely is. As I've covered this over the past year and a half, we've seen significant problems with infection prevention, staffing, and a lack of transparency in our state's nursing homes. Today, the Senate Democratic Caucus Policy Committee took a hard look at what needs to change.
As 11 Investigates has reported, more than 13,000 nursing home residents in Pennsylvania died of COVID during the pandemic, one of the worst death rates in the entire country, ranking 5th, a troubling distinction not lost on state leaders.
Pennsylvania nursing homes, without a doubt, are in crisis and have been in crisis, not just with the COVID, but actually before that.
Over the course of the past 16 months or so, we have dealt with many issues in this space, and certainly we recognize that policy changes need to be made.
All agreed staffing shortages for long-term care facilities is one of the biggest problems that needs to be addressed.
Caregivers are leaving the bedsides in droves because they cannot put in one more triple shift. They cannot break their backs at work all day, and yet no, it still wasn't enough because their residents need more and deserve more.
They discussed the need for better pay for frontline healthcare workers and increased educational opportunities at area colleges.
Just checking the boxes, looking for the things that they're required to look for.
Executive Director of the Allegheny County-run Kane Living Centers called for improvements in the state's inspection process to not just look for problems, but to also help educate facilities.
They don't give you any direction as to how to improve. They just say you have to fix these specific areas. And that's what I think is lacking in the survey process.
The state announced it is planning to use federal grant money moving forward to continue a program established during the pandemic to educate staff in facilities on issues like infection control.
There's a 30% on average turnover among frontline staff in these facilities. And so when you have that type of turnover, there has to be ongoing education that's provided.
Now, the goal today was to explore what happened in long-term care facilities during COVID and what lessons can be learned from it. State lawmakers plan to take that information to make policy decisions moving forward to help provide better care and avoid another crisis. Melanie?